You've gotten yet another activity of daily living form to complete. It seems like you just did one a week ago. Do you have problems with concentration because of pain or the side effects of the medication you're taking? Are you claiming that you're disabled because of these problems? Many jobs require a high level of concentration. You simply may not be able to work because you can't concentrate on your job duties. How is a long-term disability carrier going to determine whether or not you're just saying that to get your long-term disability or ERISA benefits, or you're really having problems? Well, for starters, the long-term disability adjuster or a nurse for the long-term disability carrier is going to call you. Based on that conversation, they'll try to determine what problems, if any, you're having with concentration. You'll be asked whether you can concentrate well, whether you can focus, whether you have problems with your short-term or your long-term memory, how often you experience concentration or focus problems. These are all open-ended questions. Of course, I'm not suggesting that you speak with them so that they can misinterpret or misconstrue your conversation with them. But when you fill out that activity of daily living form, I suggest that you speak with your doctor about any problems that you're having with concentration as a result of your pain or the side effects of medication. So that's documented in your medical records. Give the doctor specific examples and make sure that those medical records are consistent with what's being put on your activity of daily living forms. You may have problems concentrating long enough to fill out those forms. If somebody assists you in filling out those forms, explain that. If you have to try to do a little bit every day to fill out that form, document the fact that you're doing this in bits and pieces. You may even want to use different color ink and date it. Please be aware that the insurance company will have its doctors evaluate your comments about your concentration. They're going to ask their doctors whether the problems you're having with concentration are a known medical complication of your condition. In some instances, it may be even necessary to have psychological or neuropsychiatric testing to document the problems that you're having with concentration. If you're asked by the long-term disability carrier to have that kind of testing, you should immediately find an experienced long-term disability attorney, as that's a clear signal that you're being set up for denial. If your long-term disability claim is denied, medical evidence of problems with concentration can be developed to substantiate your complaints and to document how those problems you have with your concentration would impact your ability to work. The development of the correct medical and vocational evidence during the appeal process is crucial to the success of your long-term disability claim. If you have any questions, please call me, Nancy Cavey, at 727-894-3188.